Good evening. It's Dr. Montville from Tennessee Fertility Institute. Thanks for joining me this evening on another one of our Facebook Live events. Today we're going to talk about oocyte cryopreservation or freezing eggs. It's a common subject that we get a lot of questions on, and so I thought I'd kind of go through our usual discussion that we have with patients, talk about the pros and the cons of egg freezing, and as always, take questions for people watching us tonight. At the end of tonight's program, we're going to talk a little bit about a new raffle that we're having that I think is pretty exciting, and a new website to check out. And you can always find us on Google at Tennessee Fertility Institute. So egg freezing is this, it's becoming more and more popular. There have been a lot of new studies just recently. This last weekend in the Washington Post, there was an article on a woman who froze her eggs, and then she wasn't really happy with the outcome. Some of them didn't thaw very well. And so I think sometimes in conversations about egg freezing, statements like you can freeze your fertility, you can stop time, sometimes they can be misleading. And so it's really helpful to speak with a physician who has more information in terms of the actual numbers of what we can do with frozen eggs, because it really can be a great option for some women, but not every woman. And so I think that really finding those answers is really important to optimize your healthcare. As reproductive scientists, we've been freezing tissues like eggs and especially embryos for quite a while since the invention of IVF. But there was a huge shift in how we freeze tissue called vitrification. We used to do a process called slow freeze, where basic steps in the laboratory, there were several of them, and then we would slowly start to freeze eggs and tissue and embryos. But the challenging thing about the human egg is it's the largest cell in the human body, and that's a lot of fluid. And as you freeze fluid, it expands, and in early trials, they were seeing lots of eggs would fragment and disintegrate and break when they were trying to freeze them. So the invention of this program called vitrification really revolutionized how we freeze embryos and reproductive tissue. It's kind of a fast freezing process. We use different salts in the laboratory to leach fluid out of the egg, and then we quick freeze it in liquid nitrogen. And we found that it's resulted in higher survival rates for embryos, and then also higher survival rates of eggs. So the key is you can freeze an egg, but then also you have to thaw that egg and get it ready to fertilize in the laboratory. And so vitrification has really revolutionized our approach to this process. Up until about 3 years ago, egg freezing was considered experimental by the American Society for Reproductive Medicine. But now it's kind of prime time, and we primarily initially started using it for women who had a cancer diagnosis, where if she was facing chemotherapy or surgery for a reproductive cancer, that we could freeze eggs, that hopefully then in the future, that person can then use those eggs through an in vitro fertilization cycle. But we also think outside of the box a little bit and think this could be a great option for women who haven't met a partner yet, or if she or her partner aren't in a position where they might want to have children, and those who are aware of the biological clock, and as that clock moves forward, that a woman's fertility starts to decline. So it is a way that we can get eggs, say from a 35-year-old woman who's not ready to have a pregnancy, and then 3 years later thaw those eggs out and try to create embryos. It's a really great way where we can hopefully help women and families build their families when they're more ready, or when they're more financially stable and ready to move forward. So I'll kind of take you through some of the initial questions that I get in my clinic about whether or not a person is a good candidate for an egg freezing cycle. And then importantly, we'll kind of talk about what happens with those eggs after we do thaw them. Our initial consult visits always go through a woman's past medical history. So we look for anything that could potentially have damaged the ovaries, prior radiation or chemotherapy, prior ovarian surgery. And then we do some standard blood tests called ovarian reserve markers. There are two different tests we do. One is on the third day of bleeding on a woman's cycle. That's an FSH estrogen test. That tells us a lot about kind of the quality of the eggs. The other test we do is a test called an AMH level that tells us a lot about the potential number of eggs that a woman has. As women get older, especially starting around age 33 to 35, the number of eggs in the ovary does start to decline. So much so that by the time a woman reaches the age of 40, only 10% of women at that age will actually be able to get pregnant. So not only does the number of eggs start to go down, but the quality also changes. And when we think about egg quality, we think about how healthy are the proteins inside the eggs, how healthy are the chromosomes. Will those eggs be able to fertilize and produce a healthy pregnancy? It's for those changes in the eggs too that we know that as women get older, we start to see higher rates of miscarriage. And that's because the chromosomes in the eggs become more unstable. And so if a woman is able to get pregnant at age 40, about 30% of those pregnancies will end in a miscarriage. If you even go delved into a little bit more closer look in the IVF laboratory, when we look at embryos from a 40-year-old woman, upwards of 70% of embryos that we see will have abnormal chromosomes that either will result in a miscarriage or won't result in implantation or a pregnancy. So by freezing eggs at an earlier age, prior to age 40, we hope to optimize a woman's fertility. So outside of basic lab testing, we often will do a transvaginal ultrasound to take a look at the health of the ovaries and then decide as we go through the pros and cons whether or not it would be a worthwhile process. We do the initial part of the egg freezing cycle is the exact same part as an IVF cycle. We use injection medications, typically over about 10 days to stimulate growth of egg follicles in the ovary. And then we aspirate those eggs from the ovary in a procedure called a retrieval. We then isolate the eggs from the fluid in each egg follicle, and we identify those eggs that are immature and those that are mature. And it's only mature eggs that fertilize, so it's only the mature eggs that we actually freeze. The number of eggs that we get really depends on a woman's age and her biomedical markers, specifically that AMH level. That gives us kind of a good indicator of, will we get 6 eggs from an egg retrieval, or could we potentially get 30 eggs? And it does hold true that the younger a woman is when she goes through the egg freezing process, we typically can get more eggs than someone who's a little bit older. So that's kind of the process. The actual time when we freeze the eggs, then people are done with medications, and so they can kind of go back to their daily routine. But the 10 days that we do the active stimulation does become pretty time intensive in terms of ultrasound monitoring and office visits. But we try to make those visits pretty succinct, usually in the morning, because we realize people have busy lives to attend to. Once those eggs are frozen, they can be frozen indefinitely. So if a woman is 36 when she goes through an IVF cycle or an egg freezing cycle, at 39 she can come back and those eggs will still be the eggs of when she was 36. So that's really the beauty of doing an egg freezing cycle. That as a woman gets older and her risk of miscarriage goes up, she can come back and try to use the eggs from when she was younger. But the key trick, and this is really one important thing to talk to your reproductive endocrine physician about, or your OB/GYN physician, is how exactly can I use those eggs moving forward? What are the success rates in terms of thawing the eggs? What is really my chance of having a baby if I have eggs frozen? If you look over time, and if you look at the studies that have been done both before the consensus statement from ASRM regarding egg freezing, a lot of the studies in egg freezing were from women who were egg donors. So these are historically women that are younger than 30, where their eggs were harvested and then frozen to use for another couple. So a lot of the initial data that we had in terms of how many babies might be born from these frozen eggs really come from these women who are really excellent candidates. They're young women, they're usually very healthy, and so and quite fertile. And so I think sometimes that has skewed perception in the mainstream media and for patients in general about how well their eggs may potentially do in the future. But if you look at the data from some of the earlier studies, there was one large study that looked over 600 different donor egg cycles that they found that the number of eggs that they were able to freeze was typically quite good, anywhere between 10 to 20 eggs. And then when they use those eggs for future pregnancy, when they thaw them out, the survival rate was around 90%. So 90% of the eggs that they had frozen survived the thawing process. You'll lose eggs, and not every fertilized egg will develop into a healthy embryo, and so you'll lose some of those early embryos over time. And that's still true with egg freezing as well. So if you have about a 90% survival rate for thawing, not all of those eggs are going to fertilize either. So I have a general rule of thumb, about 80 to 90% will thaw, then 80 to 90% will actually fertilize. So say we start out with 10 frozen eggs, we'd be doing well if we had 8 of those eggs that actually survived the thawing process. Of those, 80 to 90% will actually fertilize. So now say we have 7 early embryos in the laboratory. After fertilization, we wait 5 days before we can do an embryo transfer, and we continue to lose some of those embryos as well. Depending on the laboratory that you're using, you may see anywhere between 30 to 50% embryo loss from the time that the eggs are fertilized until you're ready to do an embryo transfer. So if you go back to our model where we have 7 early embryos, we would do well if we had 2 to 4 embryos at the end of the process. So if you start out with 10 frozen eggs, that sounds like a lot, but at the end of the day, when you actually use those eggs for an IVF cycle, we may not have as many embryos as we had originally hoped for. And then after transfer of those embryos, pregnancy is not 100% guaranteed. That really does, those success rates in terms of live birth rate really are based on the age of the woman when she goes through when those eggs were frozen. So for a 36-year-old, for example, based on national statistics, the average chance of a live birth is around 35%. One of the cool things that we can do with IVF now, though, too, is once we have embryos at that stage where we can do the embryo transfer, is we can then start to do screening of those embryos to look at the chromosomes of the embryos. So we can see which embryos have normal chromosomes and which ones don't. And we have found that in newer studies that seems to decrease the overall chance of miscarriage. And most centers across the country now are reporting about a 60% chance of pregnancy when you actually do that chromosomal screening. So that's a brief way to kind of look at how we use those eggs. But I kind of want to go back to the beginning of what really happens when you thaw the eggs and what really is a woman's true chance of having a baby when she uses frozen eggs. Because the big question that I get, number two, is not just does it work, but number two, how many cycles should I do and how many eggs should I freeze before I can feel comfortable moving forward and not having to worry about this? Most studies, again, will show that if you look at the number of eggs and the chance of live birth, on average, there's a 4% chance of having a baby per one egg that's frozen. So if you have 10 eggs that have been frozen, you have about a 40% chance of having a baby using that group of 10 eggs. So obviously, the more eggs that you have that could be frozen, the higher overall chance you'll have of having a baby at the end of the process. So that's where we take a woman's age and her ovarian markers into consideration. And so for a woman who's 37 who might want to freeze her eggs, she may want to consider doing 2 cycles of egg freezing compared to, say, a 32-year-old where she may just want to consider 1 cycle. So that also brings up a really important point, that it's important to plan ahead, not just emotionally for the whole process, but also financially. So for couples, if they're not ready to start the family building process, or for people who are focusing on career, it's really important to kind of think about, if I do want to freeze my eggs, say in the next year or two, it's important to start budgeting, start planning for that, because obviously the more cycles that one may need to do, the more expensive it will become. The other big question that I get is, what's really the optimal age for me to freeze my eggs? And there's a really good study that came out of the University of North Carolina in 2015 that looked at socioeconomic factors and really kind of over the span of a woman's life cycle. They looked at women over 7 years. What's the chance that, say, a single woman at age 33 will find a partner, have kids, before her own fertility might start to go down or decrease? And they found that over time, that really from a cost perspective analysis, but also from a time of where eggs may really work well, that they recommend that the optimal time to freeze one eggs by is by age 37. So before age 37, there's still a good chance that women may potentially meet a partner and get pregnant on their own and not even have to worry about their fertility. But if they haven't met a partner yet by age 37, then because of that change in the quality of the eggs over time, we really do think that considering an egg freezing cycle by that time is important. We do see some couples and some women too, where they've reached age 40 or 41 and they ask us about egg freezing. At that time, we really do think that that embryo freezing, or actually creating embryos in the laboratory, is a better option for some people, just because of those changes in the eggs may lead us to see quality that's a little bit less than what is ideal, that the eggs may not be able to survive the freezing and thawing process as well. And as women get older, we may not get as many eggs as we could have, say, maybe 3 years prior to that. So even though egg freezing is still a potential option for some women in their late 30s and early 40s, we really do think that trying to fertilize those eggs, either with their partner sperm or with donor sperm, to actually create embryos, may lead to a higher overall chance of having a baby at the end of the process. But that's something that we really do try to sit down with our couples with and have a good one-to-one talk about. There are different computer models available where you can log on and look online and kind of predict your success to see how well you might do. But I think it really does vary from center to center. So it's important to ask your own center about what their success rates might be. And it's also true that we still don't have a lot of data in terms of overall birth rates for women who've frozen eggs for elective reasons, or just because they want to, simply because they're not in the position to use those eggs yet. So we may have a study, women who've gone through, who have frozen their eggs 4 years ago, who still may not be in a position where they've thawed them out, fertilized them to really look at live birth rates. Of the studies that we do have, if you look at outcome data, birth, and live birth data, we don't think there's any major difference between IVF babies where couples use fresh eggs from a fresh egg retrieval or for frozen eggs. What am I trying to say? Childhood cancers, mental disabilities, all those kind of good birth outcomes that we look at don't seem to be much different from frozen eggs compared to fresh eggs. So when I sit down with a patient, I always kind of say, where are you in your lifespan at this time? And really, what's your heart telling you? So if it's a person who's 33 and it says, I really want to focus on my career, but I really feel like this is important for me, then by all means, I think that freezing eggs can be a great option for her. If it's a couple who's 36 and they're not sure if they really want to start a family yet, but they are worried about the change over time in terms of egg health, those would be great couples as well. So we really do try to talk to them and really kind of go through the risks and benefits. One of the things that we sometimes do see is for women who want to come in and freeze their eggs, sometimes the biomarkers for the ovaries aren't as good as we had expected, and we diagnose women who may have poor egg quality earlier on than what we would otherwise expect to diagnose it in. So we call that diminished ovarian reserve. And so sometimes by doing the egg studies, we do get more information on a woman's potential future fertility. That becomes more challenging both for the patients and certainly for us in the clinic staff, because we really want to do everything we can to help our patients. But sometimes those patients may want to consider using donor sperm to create embryos, and also potentially realize that maybe we may not have very many eggs to freeze as we had once hoped. So lots of different variations that we can see in the clinic. So all in all, we think that egg freezing is a really great option for women. I think it's important to empower women, to help them realize that fertility for them does change over time. But that doesn't mean that they have to put their career on hold, or if we're dealing with couples, it doesn't mean that they have to put their goals on hold. But we also have to be realistic and realize that egg freezing isn't for everybody, that there are some limitations. So again, that's why we always encourage people to really reach out and discuss with their physicians what the best options may be for them. So that's the 101 on oocyte cryopreservation or egg freezing. I did want to mention that we have a raffle. My friend Jenny wrote down some information here that if you go to yourfertilitydoc.com, yourfertilitydoc.com, you can, and if you schedule a new patient appointment to see us here at Tennessee Fertility Institute, your name will be entered in a raffle where you could win a $500 discount on either an egg freezing cycle or an IVF cycle. You do have to make a new patient appointment, though, for your name to be put into the raffle. And then I think the deadline for entry is going to be at the close of business on Friday. But that's a great way to get in to see us and potentially save a little bit on an egg freezing or an IVF cycle. So again, that's yourfertilitydoc.com, where you can enter, and all the details about the raffle are found on that website. I'm going to take a look and see if we have any comments this evening. It looks kind of quiet out there in Facebook land.
We did have one come in through email that asked about the importance of AMH and relevancy to egg freezing.
Great question. So the question is, what's the importance of AMH when you're considering an egg freezing cycle? So AMH is that one test that I was mentioning where it gives us an idea of how many eggs may be left in a woman's ovaries. AMH is secreted by a support cell that surrounds all of the eggs in the ovaries. So the more eggs that a woman has, the higher level of this hormone we should see. And so over time, as women start to lose their egg number, we'll start to see a decline in the AMH level. The normal range for an AMH, the AMH level should be over 1.0. If it's less than 1.0, it may mean that there's going to be a decline in the overall number of eggs. And that's really important for an egg freezing cycle, because that tells us that we may not get 15 eggs. With an AMH of 0.8, we may only get, say, 6 to 8 eggs to freeze. And so that starts the conversation of how many cycles might we potentially want to consider, 2 or even potentially 3 egg freezing cycles. So AMH can be very important, and that's one of the pieces that we use to help counsel women on whether or not they would be good candidates, and also help to try to predict how many eggs we could potentially get to freeze. The important thing to remember, though, is with any ovarian reserve test, those numbers aren't going to predict whether or not a woman may or may not get pregnant. We use them more to determine what kind of medications to put people on and what overall doses might we start to get the best outcome. And so we always have to take that AMH level and the FSH level with a grain of salt. But that's where AMH can be a very useful marker in preparation for an egg freezing cycle. It's also something that I recommend following over time. that say you have a consultation with a physician and you're considering egg freezing, but you don't really want to go forward at that moment, or say you want to delay it for a year, getting an AMH at that point is a really great way to have a baseline of your ovarian function, so that when you do go forward, or say you want to recheck it in 6 months or 12 months, if that AMH starts to change, that might be more of a trigger to go in and do an egg freezing cycle sooner rather than later. I use AMHs in a lot of different ways. I use it in patients who might have ovarian surgery. So I like to get an AMH before surgery and then get one after if they may have any kind of salt on the ovaries. But AMH is one of those important indicators that we use in our consultation process to help predict the number of eggs we may potentially get. Any other questions? All right. I think that's going to do it for our seminar tonight. I hope this was informative. I know it was a little faster than some of the other ones that we've done. I think, as with anything with your fertility and your health, if you have questions, go to the best places to get those answers. Either your local physician, good reputable websites can be helpful, but I think information is power, and I think with egg freezing we can empower a lot of women, a lot of couples, that there are options to help take control of your own fertility. There are ways to build families, even if other life that's happening doesn't really agree with that. I always joke that life happens. We don't have a lot of control over what happens just from day to day. But of those things that we can control, I think that information is power. And so please reach out if we can be of any help, or to your local physician if you have more questions. That's it for us tonight. Thank you for joining us. As always, you can reach us at our clinic here in Franklin. And I look forward to hopefully seeing some names in that raffle. And who knows, somebody might be lucky and win a $500 gift receipt. Thanks again, and take good care.